afternoon. Thank you, Fatima, for the introduction. This study was done by Selina and Fatima and me. Selina is busy after delivery, and Fatima is tired of presenting a lot of papers. So today I will talk about my role in this study. So we designed some interprofessional learning sessions to suit rural and remote health, and then we did a focus group study to see how the students feel like into the program. So this is the multidisciplinary approach or interprofessional learning we are trying to teach or for the students to learn how to complete this picture, that is the optimum care of the patient with different discipline playing their role. I have a small analogy. One of the silk cloth has fallen on a bush, a thorny bush, and if somebody tried to pull from one corner, it will tear apart. And if everyone tried to pick it up from 4 corners, we might get it back with the minimum damage. So, so this is how we do the interprofessional learning sessions. We have an actor and a baby. It's a sim baby. It's on some respiratory problem. The medical student is attending the patient, and we have dietitian here, physiotherapist. Everyone get together and try to manage this patient's problem. So I stand there and coordinate this program. Right. So we have all different type of participants, the medical students, occupational therapists, physiotherapists, dental students, social workers, psychology students, pharmacy, dietetics, speech pathology, and recently the exercise physiology students. All of them who come here for rural placement, and we invite them to participate in our interprofessional learning sessions. All right, so once we know who are the health students are in the town or in Micra, I write the scenario, and it starts like in a blank sheet of paper, and then we plan according to the rural setup. I think about a patient in the past which I have treated or I have encountered, and then I form a kind of a dragon wheel-like thing to suit for each profession. And after that, writing the scenario, I will meet all the experts in the field. For example, I meet the physician if I am dealing with the stroke scenario. Then I will meet the physiotherapist, occupational therapist, speech pathologist, all the experts in Micra, and get their opinion. And then we also prepare a simulated patient. So we need a patient to act. So generally our staff here are very helpful in that respect. And then we run the simulated event and do the debrief. So generally when we write the scenario, the objective is the rural aspect, rural and remote medicine is our main aim. Multidisciplinary approach is another one. Interprofessional communication, so how pharmacist is going to talk to doctor, or doctor is talking to pharmacist, all those sorts of communications are given importance. And we make sure the students understand their role in managing this patient and others' role in managing this patient. So that is also one of the objective, and the teamwork. So here we have our simulated patient who is having a right-sided weakness, and we have a nurse. He is receiving this patient in the emergency department. Medical students, pharmacy, everyone standing around and managing the patient. So generally we run this scenario in an ED setup or a GP setup, And I have done a little bit of a changes, like I start the scenario in pharmacy sometimes. Known diabetic patient coming to a pharmacy looking for reading glasses or something. And the pharmacist recognized this patient may be having some eye problem or bleeding or something, diabetic complication. And that kind of we sometimes change the scenario, not starting in a traditional way where the doctor see the patient first. We change the scenario so that pharmacist or physiotherapist can pick up certain deterioration of the patient's conditions. And also we take this management through different stages. The patients reach the hospital, then managed in the ward, and then sent to the community, and where the continued care is given. So this is our debrief session. Here, sometime I make use of the opportunity. Selina was in second term of pregnancy, so we did a scenario that she met with an accident and she's having a bit of a seat belt mark on her tummy. And it added to realism. Actually, she was having a bit of a tummy at the time. So she's having a tachycardia, and none of the students, medical students, realized that she's on a hemorrhagic shock. So, so our staffs are very good in cooperating with me in running these sessions. So in the debrief, I make it very simple. What did you learn today? How relevant this session is for your practice, and what is the take-home message. So they spontaneously come out with a lot of answers, and if they have any burning questions about the scenario, if they have not understood anything, we give some explanations. So these are the topics I did for the last 2 years. My metabolic syndrome, that is diabetic, blood pressure, all sorts of complications. Stroke, rheumatoid arthritis is mainly aimed at occupational therapist, physiotherapist, bronchiolitis, and then breaking bad news and communications with non-English speaking patient. Chronic renal failure. Once Karen West came as a patient, and she explained the difficulties of dealing with chronic renal failure patients in Normanton. Then pregnancy and road traffic accidents. Pelvic fracture, that was another scenario where a patient's life is saved, and then I had gone through a lot of long-term complications where physiotherapist and occupational therapist played a big role. Sports injuries. A lot of sports activities are happening in Mount Isa: swimming, badminton, basketball, tennis, touch. So a lot of children come with minor sports injuries. Some people come with major sports injuries. The doctors sometimes don't recognize the problem. They just send them with some analgesics. So I brought some, try to make them aware that these patients need some continued care through physiotherapy or occupational therapist. And also the exercise physiologist came here, and they all contributed in how to prevent some sports injuries and how they can prepare this patient to recover from sports injuries. And once we had a session about influenza, where the pharmacist had a big role in flu vaccine and things like that. Yeah, this is the, I spoke about the modification of scenario to say, suit the rural setup. Yeah, so patient who started on metformin coming to the pharmacist asking for some medication for diarrhea, and it may be a complication of metformin. A physiotherapist seeing a patient who is the heart failure is getting worse and worse. So they are trying to push back to the doctors. So I changed the scenario so that not necessarily doctor is the person who is seeing this patient first, or dentist who is noticing a poor oral hygiene and thought about this patient could be having diabetes. So the research, I don't want to read these things, but this is the research we did from our 2 years of work. And the questions, these questions were asked specifically during that period, and we recorded their answers and we analyzed the answers. And yeah, certain things are peculiar to the rural community, the small size of the professional healthcare community. Yeah, there may be one pharmacist, doctor, nurse in places like Vipa, Normanton. They need regular interaction. They have to talk to each other very frequently than in a metropolitan area. Yeah, so these specific features of health professionals are needed for interprofessional, multidisciplinary approach. And also, in a place like that, a couple of professionals depending on each other to manage the patient optimally. So these are the evidence came from our students. So they understood what services are available under the multidisciplinary session. They understood who to refer, who does the referral, how often they have anyone else to talk to, often they have to talk to someone else, how do they contribute, what do I do and what other professions do, mainly between some professions like exercise physiologist, or occupational therapist and OT. During the session they realized, oh, this is my role, this is your role, like that. So it's very important to bring them in the same room and so that they can talk to each other and find out what is each other's role. So that part also came out clearly in this research. And also the use of technology, teleconferences, and in this English, non-English speaking patient scenario, they used interpreter to get the information from the patient. So all these things were clearly came out from the participants' mouth as during the debrief time. So we are happy with the way we have conducted the interprofessional learning session so far, and we want to continue this work so that students get the benefit of this way of approach. Thank you very much.